I'm really excited today about the topic that we're covering. It's one that's near and dear to my heart. It's been definitely part of my healthcare career, helping to build and scale contact centers, and it's also one that I don't think just comes up enough in the course of talking about building healthcare companies. Many healthcare companies require at least one, if not multiple, contact center teams. And these are really hard teams to build and really hard teams to scale. And they have a massive impact on both the performance of the company, but more importantly, the patient experience, as well as the experience of your internal teams. And so I'm excited because we've got an awesome group of contact center and healthcare veterans with us today. So I'll give them a chance to introduce themselves in just a second. So why don't we get started with our introductions? Claire, do you want to start?
Of course. Hi, I'm Claire Fry. I am the VP of Operations at Uplift, which is a behavioral health marketplace. We connect patients looking mostly to use their insurance, but some direct pay options with providers that they can match on a variety of different specialties, areas of focus, and treatment types. We're currently in DC, Maryland, Virginia, Florida, and growing very quickly. My background prior to this, I've been at a number of different healthcare startups, mostly focused in the ops, customer care, sales, team building space. Bobby and I started out at Oscar, got to do a lot of building there. And I actually got to work with David at Willow for a chapter as well.
Great. Mark, you want to introduce yourself?
Certainly. Mark Hollis. I'm Customer Experience Program Manager for Networks and Plans at Banner Health. So I'm really focused on working with our call center customer care teams and with our care transformation teams, which also have customer care. Before that, I've spent the last 12 years at high growth startups, and I'm hoping to bring some of those innovations to Banner Health. So working with a good team there.
Great. Thanks. David?
Yeah, David Keys, Systems and Innovation Lead at Willow. So Willow manufactures a cordless, tubeless breast pump that fits in the bra. My focus at Willow is mostly, I would say, business operations systems, primarily in the customer care space, but it does stretch into finance, so integrations with NetSuite, to Salesforce, to logistics, all of that. So it's really just focusing on consolidating, integrating business systems. Before Willow, I worked with Amazon for 10 years, primarily focused on startups or acquisitions and scaling customer service teams and systems for Amazon.
Great. Well, cool. Well, Claire, let's kick it off with you. I think it's just helpful. Obviously, not everyone who's joining us is a contact center expert. So can you just give a quick definition of what a contact center is and generally where does it show up in healthcare?
Yeah. So when I think about contact center, I think about the team that's responsible for bridging the higher volume interactions between your product or your service and your end consumer. I think in healthcare, that end consumer can often be patients, it can be a third party, a insurance company, that kind of thing. And the contact center is there to be the people team, answer their questions, help service the product for them, help sell them into the product or upgrade them. It's the team that's doing all the interactions, and they tend to do them across a variety of different channels. So we'll talk about phone, email, chat, SMS, all of those things today. And technology is a big part of it. It's all about scaling, efficiency, being effective with the tools and the people that you have, so that these can be resource-driven centers instead of things that can pull from your resources.
Cool, super helpful. And so if you're just getting started, with contact centers, you don't have a lot of experience in building them. How do you start to figure out what your requirements actually are?
Yeah, so how I've always approached this is starting by figuring out what you have. And, I think that typically comes in terms of like where you are with your product, where you are with your service, and starting to look at the team that you have. Where I often start assessing is like, what are the questions that we're either getting or we anticipate getting, and then how do you build solutions around answering those, responding to those, being effectively in front of those things. I think in healthcare, like this shows up in like so many different ways. It can be, your patients need some clinical guidance and clinical support, or, there's complexities in your product that you need to help folks navigate. But it's really starting with just like assessing what you have and where you need to get your population, in terms of like where you get started in terms of what you build.
Mark, you've started and led contact center teams at certainly a number of well-known digital health companies. You didn't talk about too much in your background, but companies like CityBlock, Collective Health, Castlight, others. Talk us through your approach when you're kind of stepping into one of these companies and how you start to think about building the team there.
Certainly. So as you just said, with all those C companies that were super high growth, there's been reoccurring themes. And usually it's you go in, and this is before COVID, and there was a physical room, and it's a blank canvas. And the things I love to do are build the human team and then give them the right platforms of technology suites that we can build for the product we're supporting. So, Collective Health, an example, literally empty room down in San Mateo before they moved up to San Francisco. Thought we were going to start out doing small, medium business support for very inventive employers that were giving their employees, a really united, uniform way to shop for their core benefits at a concierge level, but also all the things these really leading employer groups were adding it to it, like Livongo and Lyra Health. And that was new territory for navigation. So looking at the product, in this case, a brand new field for Collective, and learning that product. And then really, this is just in the weeds, but writing my own job descriptions typically at all those companies, getting with if there was a recruiter, sometimes there wasn't yet, it's so early, and just saying, this is too generic. Now, with what I know of where the product is and where it'll probably be when we launch, we need to rewrite the job description based on the product. And then concurrently, so you don't burn them out the first month, meeting with the founders and with finance and with marketing, and just, saying, what are your projections? And usually their model's a lot different than mine. And so they'll have something that's very sophisticated. I'll take something that, maybe the closest thing to what Collective Health was doing is a third-party administrator, and they've given us some of their historics, or maybe it's one of the plans we're supporting, like Blue Shield of California gives us their call-in rates, percentage of members calling in. So I'll take that and do some third grade math with it and get what I think our average calls per hour will be, and what our starting staff needs to be for what marketing tells us we're going to launch with. In Collective example, and I'll stop after this minute, we found out instead of small businesses, we were suddenly faced with launching for SpaceX, Uber, Activision, Blizzard, Palantir, all high growth startups. They were enterprise, they were small, but they were growing exponentially. So we were calculating what we needed to start there. And so I quickly hired a core team, and I hired a tactical manager because I knew we were going to grow so fast that I needed to be doing other things. And then we just started making sure that the founders were interviewing those people, that I was interviewing them, that we weren't underestimating the level of representative we needed, because they were going to be working just as much with product and design as they were probably that first year with our members. So we were trying to come up with the right profile of hiring.
Got it. Super helpful. And David, from a technology perspective, what advice do you have for folks who are just, again, we're talking early days here, but just starting out and starting to think through what technology they need to get things going?
Yeah, I think if I were to build on top of what Mark was saying, you've built that human team and they're starting to operate in probably a very rudimentary system. Spending a lot of time in discovery at that point to understand what processes are they having a hard time adhering to, like there's a high variance between, this rep and that rep. Really understanding your needs so that when you go to the table for Salesforce, Zendesk, HubSpot, any of these CRMs, you're not just overwhelmed or you're not just swept up by all the features that they're going to pitch you, but you go in understanding the needs, and you can match those needs against the features that they're pitching, or if they're not, asking how they might work around it. It is really easy to get caught up in the feature set and buy into a tech stack that is really built for, growth stage startup or a massive company, when really all you need is something like HubSpot free CRM or Zoho free CRM. A lot of those will work just fine for a team of 5 or 10. I think, and then the second focus, beyond just like what features they're pitching you and what you want to do a year down the road, two years down the road, but I would really focus on structured data. So building structured data in your CRM, such as your contacts, your contact rates, your customers, if you have a connected device like we do, getting some of that data in there as well and relating it to the contact types that you're getting. Because stage one, you're really just measuring so you can manage. Stage two, you're going to start building out that customer journey and personalizing that experience based on what they purchased, what they've used. And then really stage three might be a year or two out. That's when you start implementing chatbots and those things that tend to attract people to certain CRMs. You really need that structured data so that your chatbot or any sort of automation is truly unique to that customer's needs, as opposed to what probably most of us have experienced with chatbots, which is just kind of generalized garbage thrown at you, hoping it gets you to close the chat and get away from service. You don't want to do that. So focus on your structured data, understand your customers before they even reach an agent, and then you have a chance at building some automation that truly serves them. So.
Got it. And just from like a very base level, I mean, you talked a little bit about CRM, but what are if you're thinking about kind of day one core technology stack, what are the key elements? There's CRM, anything else that you're looking at from the get-go?
I focus a lot on front-end intake. So, a lot of these CRMs will have out-of-the-box web to case or contact forms. They're very basic: name, email address, subject, description. No better than an email. There are other services out there that you can integrate with your CRM. We use form assembly, and so you can really customize what questions you're asking the customer before they reach an agent via a case, so that you can improve routing, you can gather relevant information to handle it in first contact. So that's a place that you can really focus on and expand with additional products. Most out-of-the-box solutions are going to be very basic. Very early stages, I think, I've seen mention of like Airtable and like other possible solutions. My biggest warning against that is going back to that structured data. If you're operating on that for a year and then you decide to migrate to Salesforce, Zendesk, any of these larger CRMs, you're going to probably spend 6 months remapping that data to new objects and fields, just so that you can have that historical reference for reporting, measurements, stuff like that in your new CRM when you get bigger. So I'd take some time, understand your needs, select the CRM at a very, very low tier, implement the basics of email, chat, phone, few routing, stuff like that, operate on that for 6 months, look at your data, then decide how you expand your feature set.
Got it. That's helpful. And just to tie that together, if you're starting with one of these kind of more simple, basic CRMs, the process, I'm assuming from what you said, it's much easier than to transition. If you then 6 months, a year down the road are moving to a full-fledged Salesforce instance or something like that, that transition is much easier if you've started one of these kind of free tier versions.
Yeah, you're collecting so much data. I mean, even if you start with HubSpot and then you migrate to Salesforce, you're at least starting with a competitor that Salesforce is going to know how to transition or migrate you over to, and help with that data mapping. If it's like Excel and Gmail and this like magpie of solutions, you're kind of on your own, and you're going to have to export, really clean that data, and then import, which it does take a long time. So my suggestion is start with understand your needs, find a platform that's going to meet those needs, short and long term, make the investment or even free, and try to keep that data schema the same across every stage of your business.
Got it. Claire, Mark, anything you guys want to add from the early stage technology perspective?
Yeah, I think for me, the thing that I always think about there too, with like, I know that I kind of always know I could build something in Excel or, build something in Google Sheets, but it's like this question at that stage of like, what do you want to be good at? And you structuring a fake CRM probably isn't the best priority when, like David said, there's a lot of free and no cost solutions out there. Like, it might not be perfect, but they've got some skill and technology that they've built that is actually going to start highlighting for you some of the things you need to be doing or thinking about, or even like collecting. Like I've learned like, oh, hey, like we need to be collecting this field because somebody else mentioned it in like an early tech solution. The other one that I'll add there is, I think especially in healthcare, because it's hard to do any of this without good phone systems. Like, it's rare that you're doing something exclusively offline, like off phone. And so those free and early solutions, they often have integration with different telephony solutions or even their own built-in like Zendesk Talk. And like, then you've got call recording from the beginning. You've got some of those things that you might not be ready to use yet, but you've at least your earliest team members know that their calls are being recorded. You have access to them when you're having an issue and you're like, oh gosh, I need to listen to that call, like those kinds of things. You might not have even thought you needed those things, but then they're just kind of there for you versus, like David said, the hodgepodge of you just kind of putting it together yourself.
Yeah, I'd love to tack on to what both said. At City Block, when I got there, the New York market had a hodgepodge of, this clinic was using Dialpad, this clinic was using Ring Central. They had a laundry list of numbers that hadn't been managed, that they didn't know where they were routing to. They had over 100 mobile work phones that were rabbit holes. So product helped me, and we ran a test, and we found out that over 30% of our members weren't getting to the community health worker or the assigned RN that they were trying to. So right away, like Claire said, once we had the team on a combo of Zendesk and TalkDesk, suddenly we knew more about their utilization and performance and who had touched it and who hadn't touched it. We even let the clinical team, they used it to set panel size because the existing tools couldn't give them that insight. But with a quick combo of Zendesk and TalkDesk, we could actually say, okay, this group of community health social workers, they have a panel of 60 and they have an average duration of 8 minutes and follow-up of 6, and their quality scores are also high. So when we're asking to stretch the panel size, and a lot of the teams are saying it can't be done, we had material proof in the data that those managers could use and say, you can do it, in a positive way. And they didn't have to argue it out. They could just say, look, here's how it's done. And it was just great proof points. And as David was saying, a lot of people don't know Zendesk, for instance. You can get fully supported Zendesk if you're Series A and B for 6 months. And that's an easy sell with your finance people, because you can walk away. It's not smoke and mirrors. They really will let you fully build out Zendesk, and it comes with their integrated talk product, which if you're not having high volume, which we were able to use at My Nurse AI, we didn't need TalkDesk. So we had this 6-month learning period and recorded calls that they hadn't had before. And we needed those because we were in AI, natural language processing, and our engineers needed buckets of recordings. So yeah, there's a lot of fun things for free or are very inexpensive.
Good to know. And this is not sponsored by Zendesk.
Am I allowed to give examples like that?
Of course, you absolutely. I know. I'm totally kidding with you. Okay, so I want to switch to the people side of things a little bit. We talked a bit about technology now, but obviously these are large people teams, and getting that right is arguably the most important part. And so, Claire, I want to come back to you. You've obviously scaled a bunch of these teams over the years, tight timelines, often at high volume as well. And so I'm just curious to hear about some of your learnings from a hiring perspective, how to do that effectively and efficiently.
Yeah. So I think for me, what I've learned is you structure your hiring process as soon as you can, like from the beginning, if possible. And you focus really on a couple of key attributes. One of the things that I found in, Bobby and I went through this together at Oscar is you're often hiring for these roles when you don't have this full panel of super trained interviewers at your disposal. You're trying to do this really quickly, and you're often using people who are new to interviewing. And so what I've learned is, similar to what Mark was saying in the beginning, you write really clear job descriptions, and then you pull out the key attributes that you need for this role. So if it's a service type role, customer experience type role, you're focusing on empathy, you're focusing on ability to navigate this patient population, if you're working with seniors or pediatric mental health, something like that. And you focus on communication, because that's the crux of these types of roles. Similarly, if you're looking on the sales side, you've got drive and passion, you've got perseverance, and you've got communication skills. And you design your interview plan really structured around that. Like, how do I assess for these three things? And one of the tricks that I've actually learned is I assign the interview panel so that, say we're assessing for three things. One person is responsible for assessing for one thing. So, in this case, David does the empathy interview, and his goal is to sit down with that person, whether in person or Zoom, however you're navigating this, and assess if they've got empathy. Mine's to assess if they've got, the passion for the population. Mark's is to assess if they've got the communication skills. And we can come together at the end of that, and none of us are trying to evaluate, is this the perfect CX rep for our company, when we don't even know what CX is going to look like in 6 months. But we are responsible for saying, can they do the piece of this that I need them to do? And it allows you to get really systematic from the beginning. And you start to be able to assess against those things quickly and in a scalable way, so that, like, when you're hiring your first, you've got somebody who's equipped, and then when suddenly you need to hire 10 at once for one class, you're able to do that really quickly. I used to say, like, especially at Oscar, when we'd hire huge classes ahead of open enrollment, it almost became like this big ship of recruiting, and you launched it, and then it just ran, and it was actually harder to turn it off and like change it than it was to like not have it effectively fill the classes and the roles that we needed filled at that time. And so I think it's one of those things that I think you can say, oh, we'll find people, but if you invest in it early, the people you find and what they're able to contribute to the growth of your team, so meaningful. And so it's become something that's like really, really important to me.
Got it. David, I want to shift gears a little bit, something I know you've talked about before, which is around the importance of documentation. And again, I think particularly in the early days. So we'd just love to hear you talk a little bit about, why that's so important, and any sort of best practices, for some of these early stage teams.
Yeah, I mean, early days, it's mostly around training, and just if you have attrition, maintaining that knowledge if there's turnover. So, I mean, customer care agents, customer care teams, the industry knows there's high attrition, and so it's really important early on to document. Hire someone to write your SOPs, maintain those SOPs as they change. And that is whether it's training materials, SOPs that are referenced live in production by the agent, email templates, everything that you can document will ensure consistency across process, and ensure consistency across the experience, the customer experience. So scripts, blurbs, email templates, things like that. I think, most in the customer care industry that's had some experience knows that's important. The other piece that's kind of overlooked, and I would say it's better when you're a little bit larger, but it's good to start early, is documentation around content, so content metadata. And so if you think about all the pieces that come together, so you have I'll kind of take you through like a case experience. So a case comes in from a contact us form. That case can actually be labeled or tagged with metadata that says this customer came prior to the contact us form. Their previous help page visit was X. In the contact us form, they said their issue was about Y. So coming in, now you know who to route it to. So it might be a specialty team that handles complaints. Well, if it's a complaint, your system might spin up a complaint record under that case as well. When the agent opens it up, if you have tagged or labeled your content internally, such as email templates, knowledge articles, knowledge articles, email templates, like those can be served to the agent the moment they open the case. So the agent opens the case, they say, this seems to be a medical complaint around X. Here's the knowledge article for troubleshooting X, and here's how to respond to X. So that really can start building a flywheel of efficiency in your process and your systems. And that can start early on. So anytime your content management team is building SOPs, knowledge articles, email templates, make sure that your system has those tags, labels, so that you can categorize and map and serve to agents when they're working.
Makes sense. I want to sort to shift gears a little bit and talk about as you start to reach scale. So moving kind of from the early days into more scaled teams. Mark, I know you've obviously led a number of these large teams. Do you have any advice for, say, managers who are, this might be the first time they're starting to, manage a team that's, 10, 20, 50 people, on kind of best practices or pitfalls to avoid?
Sure. Yeah, I think I originally came from the BPO world, affiliated computer services, where it was very transactional accounts. It wasn't before I went into health tech. I had 650 FTE and compounded attrition of over 100% annually. So very unhealthy. So the first starting point, I tell managers that I've hired when I'm stepping a degree away, is we've got a healthy culture for customer care. That's sometimes the most difficult part of a startup to keep healthy, because sometimes there can be some marginalization, at least in that team's mind, compared to some of the other departments. So you start out healthy because everyone's eyes, the founders, the senior managers have been in contact daily. And so I tell that manager, your job is to keep that continuum going. When we add that raft of a class, like Claire was saying, suddenly you have a training class of 20 or 25, where before you only had 5 people working on your team. That manager needs to use their data and their numbers, but sometimes they make the mistake, because you've drilled that into them, that they suddenly think, I'm managing this team, I'm just going to tunnel in and not be present as a people manager. And so then the culture can really be deteriorated by that, and you can start to have the loss of knowledge. So that's one of the first basics I really try to model, that you need to be continue to be a people manager. And one of the tactics you can use is don't underestimate the people that you have on your team. So typically my road has been, you take that first 5 or 10, and then when the next 5 or 10 come in, you're promoting that first 5 to pod leads with very comfortable ratio, because they've never been managers before. Their manager is going to probably have 5 of those pod leads, and each of those pod leads will have probably 5 to 7 people under them. So those are healthy ratios that can help them. And then if they don't underestimate and they use their time to have everyone know the business whys, the business numbers, as much exposure to the reporting and analytics as they can, even down to the agent level. I was shocked with what projects I could hand off to the manager and to the pod leads. And so then they're modeling, and they're really doing a dual track. and conserving time while they're getting both the analytics part of their new management responsibilities done and while they're being that people manager. So that's just one, I think, crucial example that you have to maintain.
Yeah, that really resonates. Claire, you've obviously seen this movie a number of times as well. Anything that you'd add from your perspective?
Yeah, I think Mark hit it with it's really about just balancing, like where can you give somebody structured management and then still allow them to be really good at being managers. I think like it can be a pitfall of startups that you don't necessarily allow people managers to just invest in that it's, it's all about filling the time with projects and data, because that's, kind of what our inclination is and how we get really fast. But especially in contact center, the relationships are so important. And I've found this is even more important in the remote environment. And so like giving the manager space and time to do those team building things, to interact with their team, to set their own communication norms. For new managers, sometimes you have to say that as that's an expectation of the role, and that's something that they're going to need to figure out how to scale from 5 to 25. But just saying it allows that to start to happen. And then, the data and all of that will be there. But it comes down to them being able to work with their people and lead their people effectively. And so you have to create that space and structure for that as well.
Makes sense. Want to shift gears again a little bit within the, so from maybe the management side to maybe the operational support side. So Claire, again, maybe sticking with you, what are some of the key elements of operational support that tend to exist at this stage, and how do you start to think about resourcing them as the team scales up?
Yeah, so the ones that I think about at this stage are training, knowledge management, quality assurance, workforce management, and then you can call it a number of different things, but some sort of like efficiency, operational efficiency, process improvements, program management, like that sort of thing. And what I've found is it's going to vary by your company, by your team, by your timeline of scaling, on which ones of those do you need to turn into full-blown functions and which ones are just responsibilities allocated across your team. But what you can't do is you can't forget one. You can't like not have training and then all of a sudden it's this huge fire drill. And you've lost all of your recent classes, and then you're like, hey, we might need a training program because it's not working. So what I always recommend at this point is that what those buckets are, and you think about how to resource them at any given time. You just do little check-ins on that. And it's everything from you hire a full-blown QA person and they're responsible for it and they have a team and they have scorecards and it's a full-on program, to QA is a responsibility of your team leads or your pod leads, like Mark mentioned, and they have to listen to 1 call per person a month. And, if that call failed, they listen to 2, something like that. So it's really just about knowing what those operational support metrics are, checking in with them and making sure that you're scaling them as well as what you're scaling on the people and tech side, so you don't totally lose the pulse of one of them and go all of a sudden, oh shoot, we need X, because that is the absolute worst enemy to scaling, is when you have to stop and restart and like fully build something. And what I've found is it's never the people, it's never the recruiting that happens, because that has to happen to scale. It's always one of those things that just gets missed or way under resourced, or some disaster happens, that sort of thing.
Do you think there's any one that gets missed the most or under resourced the most, or do you think it just totally varies based on situation?
In my opinion, it's QA. Because it's the easiest one to be like, we're doing fine. We've got call recordings. I could listen to them if I needed to. It's the like most easily dismissed. I think the second, and the one that I would guess David would say would probably be the knowledge management documentation side one, which then, lends itself to the others. Because it's also easy to just rely on the knowledge of your first core group. and not ask them to write stuff down, and just, it's in their brains and you can always Slack them. So here we are. So it's probably QA first, knowledge management second, in my opinion.
Got it. David, I want to shift to efficiency. Obviously, I know a huge focus for you. So can you just talk a little bit about what data and information you look at to determine how efficiently a team is performing and how you think about using it to drive improvement?
Yeah, I got it. So I think I'll split it to like measuring performance and then improvements, because the day-to-day measures that we get out of CRMs or Excel or whatever tool you're using, SLA, average handle time, customer satisfaction, those are pretty standard, and either they come out of the box from your systems or you're used to working with them in the space. But I would say a different angle on each of these is, if we're to kind of go through those functions of like workforce management, you're probably looking at interval analysis and how well your team is staffing against the needs of those intervals. So understanding when this call volume, when this email volume is coming in by half-hour, 15-minute intervals, translating that to full-time equivalents, and understanding how well we're matching that. If it's in the quality space, customer satisfaction is typically standard. However, you can go wrong in so many ways with that. If you give the agents the data, or the supervisors the data, they might be looking at it over the past week, which means they might have 2 surveys to consider their quality against. And when that's put into a number, it can swing from 100 CSAT to 33 CSAT week to week. One thing that I like to do with customer satisfaction is do what I call a mix adjusted CSAT score. And basically what it does is it takes a statistically significant amount of data, so maybe 2 months worth of CSAT, and weights it based on averages across the issue types and the channels. So for instance, if I have an agent over here that is working all phone, and then another agent who's working all email, chances are the phone agent's going to have a higher CSAT. It's just a better experience typically. And so what we do is not only channel, but issue type. Are they working in escalation? So they're mostly working in very high emotional contacts, which don't have great CSAT. It basically, what it does is it weights their CSAT against the average of that channel and of the issue in that channel. And so it normalizes it, then give that to the supervisor and have them coach on CSAT. What else? I guess moving on to improvements, typically, whether it's the agents or the systems that I'm looking to improve, I'm always going to start with a Pareto analysis and understand what are the issues driving the most volume. So typically 20%, sometimes 10% of your issues are going to drive 90%, 80% of your volume. Once you zero in on that, that's when you might have 5 or 6 issues that if you can either drive case deflection or you can process more efficiently, there are huge wins in those buckets. And so starting, once you zero in on that issue for an agent, managing agent performance or efficiency, I'll usually look at variance. So if it's issue X comes in, whether it's chat, email, phone, one agent handles it in 3 minutes, typically another agent handles it in 15 minutes. That variance shows huge opportunity. If it's 3 to 5 minutes, chances are there's a process that's being followed and there's not much deviation from that process. If you're finding that huge variance, that's where you go in and you understand, is the process difficult? Is a complex decision tree that agents are just getting lost in? If so, that's where technology can come in to help. So building out flows in your CRM that guide them through, that decision tree, but automated, or brings in information that's already on the case so that the agent doesn't have to enter that. So there's, I think it's a mix of, what variance are you seeing in quality, in average handle time, in all of the, agent performance metrics for the same issue in contact channel. And then from a system side, where can you make it easier for the agent to find information, or enter information or work through a process through automation.
Got it. Got it. We're starting near the end, so I want to cover a couple more topics before we get to a little bit of Q&A. So one topic we haven't touched on at all is outsourced contact center teams. And so, Mark, wanted to come back to you. I think there's often a bias, and maybe an unfair one, certainly within healthcare, the digital health space, that you need to keep everything in-house, because the patient experience is so critical to the business. But I'm curious how you approach the decision in general of whether to build something in-house or whether you should think about outsourcing it.
Certainly. So I'm probably biased too, because I was the outsourcer until 2010 when I defected and went to Castlight Health in San Francisco and saw what wonderful resources a San Francisco startup can give you. But so I started out in the BPO world, business process outsourcing, and saw some of the things I do really well with analytics and getting things down to the nth degree for 50, 60,000 calls a day. And I saw definitely unhealthy things that I didn't want to be a part of. But that being said, I think today there's a hybrid, a generation of boutique outsourcers, BPOs, and a step up mid-tier BPOs that will give a startup that has 5 or 10 FTE quality support. Whereas before, the big BPOs they wouldn't even look at a contract that was under 100 FTE. I mean, this is just 15 years ago. But now you have these groups. I'll give you an example. At Suki AI, we had to humanly audit each medical transcript and blur it out until our software would do a run on it. Our human auditor would look at it, and then we would unblur it after that human did it. We were doing that in California. It was super expensive, about $13 a note. And so we were hoping, our software will get good. So we started 5 pilots at once with BPOs. We had Oregon, California, India, and the Philippines. And we were just testing their quality and their efficiency. And we actually found a BPO in India because they could do the audit faster, and we got that per note human cost down to under $2. So that gave us a year runway. And then before that year was up, our software reached the accuracy level that was equal to or surpass our competitors, but then we had less clicks to use it because you didn't have to be in the EHR. So great experience using BPO. So I typically just take a step back. I look at 2 things. What is on the horizon as far as contracted clients and their size and what marketing is telling you they're going to do, especially product marketing for engagement and what that's going to look like. Do we have the internal resources to handle it? And then 2, what are the contractual SLAs that are going to drive our decisions if we've got X team with a bandwidth of, handling 1,000 calls at a service level of 90 and 90% answered in under 10 seconds? Can we hit that contractual? An example of that would be City Block. We decided to go with a very inexpensive, not a full BPO that's like $36 per hour per FTE, but with a medical answering service because we thought it's only going to be in these little spikes. So intraday during business, they were our overflow. They were just air traffic control. If it hit our switch and it talked us and we were all occupied, it went to them. They thought it was a City Block employee, and they basically opened a Zendesk ticket. We were both on Zendesk. If it were admin, there was a more elongated time. We didn't have to worry about it till next business day. But if it were medical, clinical related, then there could be a warm transfer workflow protocol to where they could actually look first at our virtual RN team, or then they could tertiary go to our clinical RN team that we had put on TalkDesk. So we were able to play really well. We then took that same model because we couldn't afford at first to hire primary care providers for after hours. So you're talking about, 20, 30,000 a month compared to what we were able to do for 5,000 a month at pretty high volume is, again, at 5 o'clock, these Friday, it would go not to us, but to this answering service. Admin, it waited till Monday. Clinical, anything related to clinical, it then went to a nurse advice line BPO that we contracted. They had signed off on protocols with national protocols with our medical directors. They could either resolve it, and that ticket would be driven in a Zendesk for review by our clinicians, or if by protocols that were signed off on, they needed to warm transfer, then it went to our on-call internal city block doctors that did have to be on call, but it wasn't like literally, they were on call almost every night for the first 6 months. So it was a relief valve. I'll tell you one other funny story. At Collective Health, here's how we used a BPO. And I think, David, you'll like this. So we wanted to break the system. So before we launched for SpaceX and Activision Blizzard, we got a call, the same answering service. We gave even their supervisors, we tried to get 80 to 100 of their people to do live calls into our team and not only see how they handle these scripted, inquiries as far as what their response is, if they would look up the knowledge base, but we wanted to see at that time what interactive intelligence would do with their capacity before it would break. And it wasn't breaking. And so one of our engineers wrote a couple of lines in Twilio, and then he automated another 100, 200 calls on top of the live calls. And then interactive intelligence started to shut down with the way we had our purchase bandwidth at the time. So they were really game with that. So you can do a lot of fun things with the new breed of BPOs.
Yeah, super interesting. Claire, maybe one quick follow-up, and then we'll shift to some Q&A. For folks who haven't worked with, a BPO or an outsourced firm, what advice do you have about evaluating them? Because that can be really hard if you never worked with them and don't know what to look for. And any other advice, just generally in terms of whether it's contract structure or managing them, anything in particular you'd want to highlight? Yeah,
I think my advice is to have the conversations with a couple, like 3 minimum. I think, in your haste, you're going to be like, this one's great, and just run after it. But talk to at least 3, find an easy RFP template online, and just use one and use that one to get yourself started. What I found working with BPOs, especially if you're building for the first time, they actually know more than you, and that's okay. They will ask questions that make you think about things that you're like, oh gosh, I need to think about that. And so as you talk to multiple of them, you're gonna have some of those light bulb moments. And even if you don't end up going down the BPO path, the learnings and the structure and the things that you start thinking about because of the conversations are going to stick with you. And they're also going to stick with you if you didn't use one then, but a year from now, you all of a sudden have 5 pilots that you need to run. You're going to remember those names, have those relationships, be connected with them on LinkedIn or whatever from a year ago. And that has been an asset to me. I think when you structure your contracts, feel free to ask for things. They're gonna their contracts are going to be really structured. They're going to have written them before. You're not. But it doesn't mean you have to take them as is. I think the 2 big ones that I always ask for now is a lower cost training rate, than a live agent rate. The ability, I guess I'm going to say 3, the ability to have your team sign off on somebody coming out of training. It's pretty rare that you're going to be able to influence the actual recruiting of the agent, just because of firewall type employment law kind of things. But to have the ability to say, yes, this person is ready to go live for my product, for my team, and to have that be an assessment that you can make has been really valuable. And it also ideally is then tied to they then start to become more expensive, but you get more value from them. And the third one is build in some sort of SLA or some sort of metric that allows you to have an out, some sort of quality metric, put in the contract from the beginning. This one is so hard to do because you're going to be sitting there going, I don't know what I don't know, but they don't either. So put something in there It gives you something to have a conversation around in your QBRs, your, WBRs, all of those things. You can always adjust it. And you're going to be fair, they're going to be fair, ideally, because that's what these good relationships can be built on. But if you don't put it in there, it never gets added back. And then when you have troubles, you don't get to have like something concrete to talk about them with. And so that's just one that, like, Bobby and I, in our first ones that we wrote, we were like, we don't know what to put here. Let's leave it blank. Like, I literally remember that conversation to this day, and we regretted it so much that I've never made that mistake again. So that was a big learning one for me.
One of many painful lessons. Cool. I want to shift to a few minutes of Q&A. So one of the questions we got in is, how do you think about introducing pre or post contact center communications? For example, email, mail, SMS, to improve agent efficiency without diminishing customer experience. So I'll put that to the panelists if anyone wants to take that.
Could you restate the beginning of that question?
Sure. It's, how do you think about introducing pre or post contact communication? So email, mail, SMS, to improve agent efficiency.
I have a thought on this, but it's not a complete answer. So I'll start, and then hopefully somebody else can fill in. I think, and this is actually one that, like, one of the things that David taught me when we were working together at Willow, and I've heard him mention in this, is you can learn a lot by looking at sort of the spectrum of where your questions come in, like the topic. And you can often predict what somebody's most likely to be asking, because I've got 90% of my contacts are related to orders, or 90% of my contacts are related to X. And so I think if you can use your pre and post contact space to have it be something that is really likely to actually be targeted towards their issue, towards a piece of education that they may need about a complexity of your service or your product, it actually then just elevates customer experience, because they've learned something you've potentially deflected, which is always a perk of it. But they actually are more likely than not to have gained value from it if it's something that, a high volume of your population struggles with. And so that's one of the things that I've, since Willow, tried really hard to do, is like figure out what are the most likely tos, and see if there's an appropriate opportunity to layer them in either pre or post contact.
Makes sense. Another question that came in, what are the key hiring criteria for your first support lead hire?
I can go again, but I feel like I'm monopolizing. But I do have thoughts on this one. I think with your first support lead, so I'm assuming this is meaning the person who's like going to be your first kind of like step up into a manager, a little bit more of an SME, subject matter expert type role. If possible, I try to use this as a promote from within opportunity. I think there's just so much that you learn by doing the job. And when you've been there doing it, at a startup, you're typically like pretty ready for the next thing when you're starting to make this first hire, or I don't know if it's always the first, but if you're doing a lead, but it's around when you're bringing in like the function leader for CX as well. And, it can start to be a really like symbiotic relationship with that. So I do think that, like, I look for some internal knowledge, some readiness for growth, very coachable, like ready to step into that, because I think that is a really sweet spot that everybody can win a lot of value out of, if you both get to carry that knowledge forward and they get to have the opportunity to grow. But I do think they need to have some of those pieces that I mentioned. They need to be coachable. They need to be proven flexible. Like, I would argue a lot of these roles are difficult roles in a scaling, service contact center org. It's just hard. It's a lot of change, a lot of people stuff. And so that role can kind of be at the crux of it, because they then end up feeling like split between, the day-to-day of what they used to do and how to grow that and change that into something different. And so like the intrinsics that you're really looking for are coachability, flexibility, capacity to grow.
I
All
just
right, we're
gotta
almost hit.
tack
Oh,
in.
go ahead.
I agree
Yeah.
wholeheartedly. The internal hire from within for that first step up for the lead. And then often you will find too, for the level up from that, you often have a parallel off phone ops associate center that tend to have, some consulting background. They've been doing other things, but they know the product really well too. Sometimes if they're brought into the management tiers of the customer care center, there can be a nice, almost a dyad type arrangement to where they both have unique skill sets. So yeah.
Makes
I
sense.
love that.
All right, one more very quick around the horn here. What are your, for everybody, what are your favorite one or two contact center technology solutions?
I'll go first. So I absolutely love form assembly, which is not built for contact centers, but the flexibility in their product, it's a form builder, but it's like Google Forms on steroids. And then they have flows. So you can build forms that basically may like accordion out based on conditional formatting. So the customer selected this pick list value, therefore this interstitial help is going to pop up. It's super user friendly, no code needed. And then they also have a flows feature that is similar, but it's like a choose your own adventure that can lead a customer to troubleshooting. So a great self-service feature as well that you can layer into your website.
Cool.
I'll say one that I'm currently breaking up with, which is Customer. I totally fell in love with Customer as a CRM in the last couple of years, and they are dropping their HIPAA compliance. So I'm heartbroken over it. I'll still put it on my favorites list, but it doesn't get used anymore in this space. But maybe someday they'll change. And then I think the one that I think is kind of more like the quick win, what David mentioned a little bit more, is using Zapier, like set up things to get things talking to each other. It really matters, and it really creates a lot of efficiency and effectiveness for your team. And I am not a hugely technical person myself, and I can set up some of them. So that's been an enjoyable part of it for me as well.
So I'm going to repeat something, but I'm going to add something to it. So you already know I love Zendesk. I love it combined with integrated with TalkDesk. And a product manager, Catherine Fetcher at CityBlock, I already really knew how to use TalkDesk, but she taught me how to use the Studio Design Builder. And I felt like a designer. I felt like an engineer. I could build I believe, and actually we did this at CityBlock and Collective Health, keep for as long as you can for high complexity healthcare like those were, keep the human touch direct, no IVR, but when you learn, after you've learned, then build the appropriate ones that either members or internal teams would want. And TalkDesk Studio was just so powerful. And I could do it. I could do what used to take a telecom engineer, a third-party interactive intelligence person for the cloud part of it, and one of our internal engineers with Studio. It was really a lot of fun once the time was right.
Awesome. Well, thank you all. This was an awesome conversation. I learned some stuff. I think our audience definitely did too. So really appreciate it. And yeah, hope everyone has a great rest of their Wednesday.